So we have a 60-year-old man who has had his aortic valve replaced and comes in due to fatigue over the last few months. On exam, it is noted that he has a heart rate of 110 and scleral icterus. His hemoglobin is 9 and liver function tests show total bilirubin of 4 and direct bilirubin of 0.3. Which of the following is the cause of this patient's anemia? A. Extravascular hemolysis. B. Macroangiopathic hemolytic anemia. C. Microangiopathic hemolytic anemia. Or D. Thrombotic thrombocytopenic purpura. So I'll let you answer this question and then I'll explain in 5 seconds. Okay, so this is going to be B. Macroangiopathic hemolytic anemia. So for this question, essentially we have the destruction of red blood cells, and this is going to cause the symptom of jaundice through the indirect hyperbilirubinemia. And so this is shown by them giving you an elevated total bilirubin of 4 and then a direct bilirubin of 0.3. So that means the balance between 4 and 0.3 is going to be 3.7 worth of indirect bilirubin, which shows you that if it's indirect, it was never conjugated in the liver, which means that it's hemolysis. And so something is breaking down the red blood cells, and we have to figure out what. So for this patient, it's pretty clear because since this patient had a valve replacement, that prosthetic valve is actually shearing the red blood cells and causing them to become schistocytes. So remember, schistocytes are when the red blood cells get sheared and cut, and so then they turn into these fragments of red blood cells. And so because you're losing the hemoglobin and it's being turned into bilirubin, that's going to show up as jaundice because bilirubin has a yellow color to it. And so that's why the patient's eyes are going to appear yellow. And then the final thing is if they did this lab, you're going to have a low haptoglobin because haptoglobin actually binds to hemoglobin. And so if there's a lot of blood that's being sheared, then a lot of hemoglobin's being dumped, and so the haptoglobin is going to bind to that. And so you're going to have low haptoglobin after this hemolysis. Talking about the other answer choices, we have extravascular hemolysis. So what we just talked about was intravascular hemolysis, and just like the name implies, it's intra within, vascular within the vessels. So intravascular hemolysis is going to be the aortic valve shearing the red blood cells because it's occurring within the vessels themselves. But extravascular, just like the name implies, is outside the vessels. So it's actually going to be in the spleen. So the spleen can clear abnormal red blood cells. And so in this case, the spleen could cause hemolysis. However, not for this problem because you'd have to have a clinical history or, for example, a family history of hereditary spherocytosis. And so this type of condition would be the condition where the spleen would take that abnormal red blood cell and then destroy it. And then therefore we have the extravascular hemolysis. So, and then just to add to that, you would have similar symptoms in the fact that you would have jaundice, you would have hyperbilirubinemia, just because you're still having hemolysis, but the location is different. Okay, so moving on to the next one, we have microangiopathic hemolytic anemia. So this typically occurs when you have a narrow vessel lumen. So this narrowed vessel lumen is going to damage the red blood cells. And so that's why it's called micro versus the aortic valve, which is a macro. It's just because these vessels are smaller versus the valve, which is quite large relative to the lumen. And so examples of microangiopathic hemolytic anemia are going to be DIC, so it's going to be disseminated intravascular coagulopathy, or TTP, so it's going to be thrombocytopenic thrombotic purpura, or HUS, hemolytic uremic syndrome. And so these types of conditions cause microangiopathic hemolytic anemia. And so finally, we have TTP, which is the other answer choice. So for this one, it's actually, so notice how it's right here underneath the microangiopathic hemolytic anemia. It's a subtype, or it can cause this. And so in this case, you would have to have this pentad. And so you just have to be on the lookout for all 5 of these during a question stem, and then you could select it. But in this case, they're pointing toward macroangiopathic hemolytic anemia. So just to review the pentad, it's going to be fever, anemia, thrombocytopenia, renal, and neurological symptoms for TTP. So in summary, for this question, you just had to see the aortic valve and realize that a prosthetic valve can shear red blood cells and thus cause all of these symptoms. So I hope that helped, and thanks for watching.